Welcome, welcome, my dear friends. Myself, Professor Dr. Rajendra Raghuveer Deshpande from Pune, Maharashtra State, would like to welcome you all in my Ayurveda Academy YouTube channel. As everybody knows that I am MD in Ayurvedic Medicine and MD in Ayurvedic Physiology. For paid online consultation, you can definitely WhatsApp on 922-6810-630. My dear friend, this series of nearly about 20 videos or the 1 month series is related with the different complaints of the patient which they come in the general medical practice or the family physician, and how that family physician can start thinking about the probable different causes, which is called as a differential diagnosis, and how he arrives to the confirmation with the investigations and with the clinical examination. In this, actually, I am not interested to tell much about the hospital management or hospital cases, but still, as doctor has to visit to the patient sometimes, and the patient has to be referred to the hospital. But the people, they believe family physician first. So instead of calling ambulance and taking directly to the hospital, they always prefer to ask the doctor, come immediately for the visit, and then doctor has to do something as a first aid type of the treatment. So the similar case is there. 60-year-old male patient. The relatives called the doctor to the home, and the doctor has visited to the home, and the son is telling that, see doctor, my father is not talking and not responding since last few minutes, and actually he had taken his lunch in the afternoon, say around 1 o'clock, and then after when we were watching the TV, and all of a sudden we find that he has fallen down on the ground, and in the bathroom, and we have taken him into the room. So we don't understand. He is unconscious right now and we can't do anything. So shall we immediately shift to the hospital? Okay, just relax. Give me a few minutes and I will try to find out and what to do exactly. So the doctor should first step in unconscious patient, first check about the airway. Airway should be clear, and check whether patient is in a shock or whether he is not in shock. Actually, there the resuscitative measures, as always, cardiopulmonary resuscitation, this basic technique should be learned by the doctor as well as by the common man. So resuscitation is most important and it should be started immediately. Okay. Then fast history taking can be done. Of course, this video may be of 3, 4, 5 minutes, but this much time is also not there. The doctor is taking very fast decision. So the first question, whether the patient, this attack of unconsciousness is a sudden or gradual. Of course, here they have already told that he has taken proper lunch. The patient was in the bathroom for the washing the hands and he has fallen down. So this is a sudden onset. So it depends. The unconsciousness reasons can be distinguished as per the sudden onset or the gradual onset. Now I am not discussing only about this patient. I am discussing with everybody about the probable examination methods or the history taking, questions, interrogations regarding unconscious patient. The doctor must check or ask about the head injury, and he himself can check whether there is any wound or the bleeding and anything around the head. Okay. Then he can ask about the convulsions, fits, convulsions, epilepsy, whether the patient is known case of epilepsy or he doesn't has any convulsions any time in his life, and even right now before unconsciousness he did not have any convulsions. Then you can ask about high fever. Very high fever, uncontrolled high fever can also give such type of the unconsciousness. Then also you must ask about the diabetes. For diabetes, I have made a separate video on unconscious diabetic patient. Please check that video, because there are only two what you can say the important things one has to check: whether the diabetic unconsciousness is because of the hypoglycemia or hyperglycemia, whether it is because of the hypoglycemia, low blood sugar, or whether it is because of the hyperglycemia, high blood sugar. Okay. Then doctor should check whether the patient has taken any alcohol, excess alcohol, or is there a chances of poison ingestion in the what you can say, the because of the suicide or because of the homicide, poisoning is possibility in unconscious patient. Then general examination, first doctor should check the temperature, then he can palpate the pulse, whether it is a pulse is slow, whether it is fast or irregular. Then irregularity is always arrhythmia and related with the heart. Check the blood pressure, whether it is a what you can say, the malignant severe hypertension. Then there is a problem with the space occupying lesion in the brain, that is thrombosis, embolism or bleeding. This can cause this particular unconsciousness. Then doctor should check the respiration style and the rate, whether the respiration is a slow, whether it is a rapid, whether it is a deep, irregular, Chinese stroke respiration. Then doctor can get a judgment about breath smell of the person or the patient, whether there is any smell of poison, alcohol, ammonia, acidotic, or the fetid hepaticus. In the liver problem, there is a typical odor smell, that is fetor, F-E-T-O-R, hepaticus. Then note the posture, that means at rest and after giving a painful stimulus, whether it is a flaccid type of the body or desperate type of the body or decorticate type of body. These are the different styles. I will explain at some another lecture what are these conditions of the body. Then if there is a profuse sweating, all the clothes are drenched with the sweat, then there are two important possibilities. One is hypoglycemia and second is a heart attack. Next, doctor should examine from head to toe. Examination from head to toe. Palpate the skull for the bogginess or the fracture anywhere, any wound anywhere, any bleeding. Examine the ear for discharge, any blood or cerebrospinal fluid. Then doctor can check the eyes, especially for the pupils, whether they are constricted or dilated. Then doll's eye movements. Then he can check about tongue, if possible, dryness and bite marks. Then neck rigidity, Babinski sign. Then doctor should check the auscultation of chest, respiratory sounds and heart sound, abdomen for any tenderness, fullness. Then give the painful stimulus and see the response. Note for the any weakness of the limb or the facial paralysis or body paralysis. So I think here I am not give you the exact diagnosis by a different thing, but I am just mentioning how the doctor should proceed for the unconscious patient. I am sorry, this is a very short video because I just wanted to give the hint how the unconscious patient can be seen for proper diagnosis. I know this is very incomplete type of the feeling that is in your mind. Each point can be elaborated in my different videos, but at this moment I am stopping over here to give you the brief idea about the unconscious patient. So my dear friends, I wish that you can, this is important video, to please like and share this video, and don't forget to subscribe my channel, press the bell button icon to get the notification of interesting further videos. I wish all the best, take care and see you in the next video. Thank you very much.